Hello, welcome all. Next, we have an incredible panel of colleagues who are working in various regions on language revitalization and access. We're going to start off first with Nicole Zavala. Thank you so much for joining us. In your role as the coordinator of the CMAR Health Center Coordination of the Promotores de Salud program for migrant and seasonal agricultural workers here in Northwest Washington, coordinating services for community members with great diversity. We would love to hear more about the program and specifically how you and your team members are addressing interpretation needs among local Indigenous Mexican and Guatemalan speakers in the Northwest. Welcome.
Good afternoon, everyone. It's a pleasure for me to be here. I'm going to share my screen with you, okay? The EMSA Promotores de Salud program was created in 2009. The purpose was to create a bridge between the community and health services by recruiting promotores de salud or community health workers. The program recruited members of the farm worker community who speak the languages that the farm workers speak, understand their barriers to healthcare because they also live and work in the same community. Promotores de Salud are the front line of this program and act as a bridge between community organizations and the farm worker community by opening access to medical, dental, mental health services, and health education relevant to this population. Because the Promotores de Salud are from the community, they trusted by them and understand the community needs. They have intimate knowledge of the daily barriers farm workers face because they face them too. Skagit and Whatcom counties are home of the most of the Northwest Washington farm worker population from Mexico and Guatemala. Nearly 60% of the people in these two counties belong to indigenous communities. The vast majority of indigenous community living in the area are represented in this slide. Those in Bulgari color are the higher numbers in Skagit and Whatcom counties. There are 3 variations of Mixteco Bajo, 1 variation of Mixteco Alto, and Triqui, all Mexican indigenous languages. Also, Guatemalan languages, Aguacateco, Chalchiteco, and Mam. There is a crucial factor: the town where the person grew up determines the language variation. The ladies in the picture are part of the promoters team and represent Mexico and Mexican, Triqui, and Mixteco community. Our team is made up of 12 members. 2 are full-time, established with the organization, and 2 community health workers hired under a grant funding. 8 volunteers. 4 of the volunteers have been of the promoters team for 7 years, and the most recent volunteer member joined a year and a half ago, which allow us to have a consolidated team. The team can offer services in indigenous languages from Mexico and Guatemala. 3 variations of Mixteco Bajo, Mixteco Alto, Triqui, Aguacateco, and Chalchiteco. Spanish is the common language of our team. It's important to mention that the front line of our team are volunteers. The limited time they give us to the program is very valuable, and it's very well invested. However, the fact that they are not staff members make it difficult for them to be available anytime. We schedule activities time ahead to respect their work, study, family time, and personal activities. We have found Indigenous Aztec and Mayan languages in Escayet and Whatcom counties in the last 7 years. The orange color identifies them. For the new generation, those who are between 20 and 30 years old, who migrated to the United States as a children and who had the opportunity to attend school in this country, language is not an obstacle. Most of them are trilingual, with English being their second language and Spanish being their third. These family members have been helping their parents by interpreting during medical appointments and using other community services. They belong to one culture but grow up in another one and have appropriated, integrated in both cultures into their lives. They makes them versatile and very necessary with the organization that offers services to Indigenous community in the area. Considering that many farm workers are illiterate or have low level of literacy, it's essential to consider that people need more time to process their information before they understand it. They need help filling out forms or reading labels. There are some concepts or words that don't exist in the Indigenous languages. The comprehension and learning process is lower than for others, and very few speak English. And if they do, it tends to be younger generations. We all need to practice culture humility, impress compassion in the service you provide to them. A smile will make a huge difference as well. Providing interpretation services to them is a critical issue that we, as an organization that serve them, urgently need to address. Poverty, education, race, age, disability are factors that influence an individual health literacy. Our community face high mobility, limited income, lack of health insurance, health belief and practices, inability of sick time, lack of transportation, insulation, loneliness, among many other barriers. If we can help them by making the delivery of our service and communication more accessible, faster, and simple, we are really helping them. We focus on migrant and seasonal farm workers because they have unique barriers and special needs to access healthcare and other services as well. Thank you for your attention.
Nicole, muchas gracias. Thank you. I've had the pleasure of interacting with Nicole and being involved in work with her. And I got to tell you that the work that this team does is amazing, and their willingness to really lean in with us all. So amazing and a great resource to this community. And I hope that as we're having these conversations, we start getting some ideas of how together we can improve experiences throughout. So now, next in our panel, we have Dr. Charlie Jose and Joanna Cleary. So both from Ketchikan. Dr. Charlie Jose is a Ketchikan physician, and Joanna is an infection preventionist over there. In addition to their clinical roles, what's really awesome is they both hold masters in public health and are super champions for improving health and health access in their community of Ketchikan, Alaska. We've heard about it here in Washington. We're looking forward to more. So one of the things that they've done is they've recently finished writing up their research as a part of the Sama Sama Tayo Health Equity team, and hope that they will be able to publish their findings soon on the experiences of accessing healthcare amongst the Filipino community in Ketchikan. Before we segue in, I want to take a moment to ask them, how are you feeling about this? You have served as a source of inspiration for us down here, believe it or not. And we want to know, how are you feeling today? How's the summer going for you?
I don't know if you want to start, Joanna. I could chime in. I'm Charlie. I work up here in Ketchikan. I have been fueled by a lot of the discussion that we've had today, especially with Dr. Lyons' talk and Dr. Adford's talk, mainly because it sounds to me that we are facing a lot of the same issues in different regions with different cultures, and it's all about us coming together to try to think of a good solution for the frontline workers in healthcare as well as our patients. So I think I've had a great few hours.
Yeah, I echo that. I'm actually fired up right now just listening to the presentations and feeling that we are really on a good track with our research here in Ketchikan.
Awesome. So this is a perfect segue. I'm going to let you both talk a little bit more about what the research and the experience in Ketchikan has been like.
Yeah, so I was going to start off just talking about our research and how it ties into Dr. Hartford and Dr. Lyon, mainly in the realm of accessing care and what communication actually means in the healthcare setting. For those of you guys who don't know much about Ketchikan, we actually have a large subpopulation of Filipinos here. Most of them have come by way of the cannery industry and the fishing industry, and they've been here for many, many decades. And that was one of our inspirations to try to take this on as a community. Our public health department had put out a needs survey a few years ago, just with respect to how Filipinos were accessing healthcare. What did they think about how much healthcare costs? What do they think about the local healthcare system? And we had realized that there were a lot of challenges and barriers. And so with our current study, we decided to interview qualitatively our community to see what those factors specifically were. And throughout our entire research, it really boiled down to three cross-cutting themes amongst all of our participants. Those three themes are, what does culture and language actually mean for access? And in fact, it is a pillar for access here in Ketchikan. We found that Filipinos see care and seek care as a relational experience, which really highlights and supports why doctors need to find a way to best communicate in the most culturally competent way every single day with all of their patients throughout the day. And we also found that our healthcare structure could be good for some. It opens up more opportunities, healthcare access that they may not have gotten into the Philippines. However, as someone who has grown up in the US and has experienced the healthcare system myself, it can be pretty daunting, confusing for someone who is not used to our system. Then throw in a language barrier there, and we see a lot more challenges. So regarding access and culture and language being a feature of that, we found and we heard from a lot of our participants that they're actually using family members as ad hoc healthcare navigators, and we talked about whether this is best practice or not, some of the pitfalls of this, but how the question becomes, how do we address that as a community? And I thought that one of the most interesting points from our work was that to a Filipino person in our community, seeing a doctor access was not just about seeing the doctor. It was actually also related to being understood by that provider. I know we've all had situations where we may have a conversation with somebody. We don't feel like it really went anywhere. And we may feel like that was either a wasted conversation. We could have done something else, a wasted visit. And I think a lot of patients can feel that way when we do see them. So thinking about how we can address that as a whole is a huge undertaking and will be a challenge for us here in the next year. We also found that in terms of relational care and community-based experience, a lot of the facets of trust depends on good communication. And communication in the Filipino culture is not necessarily just about language. There are many different ways that we try to convey feelings, thoughts. And when we were talking to our participants, and when we had in more in-depth discussions with our team, we realized that a lot of trust and the communication aspect and being relatable and being clear and being familiar for a patient actually ties in with a Filipino value or a trait. It's called pakikisama, also known as just the feeling of being comfortable with somebody. And there's not a direct translation here. So when we were asked earlier, can we get by with just one language? I mean, we could, but we're going to be losing a lot of things in translation. One of those could be the trust and the feeling of comfortableness that Filipinos look for. And in terms of, the healthcare structure, I will touch briefly just in terms of the interpreter services. We found that, yes, they are offered sometimes. However, they are not consistently offered all the time. And in fact, there are some barriers amongst the Filipino community that may actually lead to a Filipino patient not wanting to get or use interpreter services in the visit. One of the things that we had discussed was just the notion of internalized racism. When you do offer a Filipino patient interpreter services, we do it because it is the standard of care. However, that can sometimes be interpreted as, oh, well, you don't think my English is good enough, or you don't think that I'm communicating well with you. So that is a deficiency of mine. So I really like the comment earlier about how when we are talking to patients, not making it about them, making it about us as providers and how we can improve their care. So those were some of the highlights of our study. There were certainly more things that we explored. And then Joanna was going to talk about, what does communication actually mean for the Filipino community.
Well, thank you, Charlie. So just listening from the presentation and reading the chat, it appears that we all agree that language is a carrier of culture. Translation or interpretation is not just a mere shift of two languages, but it is actually a shift between two cultures. It is an exchange. So it is then very important that translation has to be culturally focused, which we already our presenters have discussed, and it has to at most accurately reproduce the meaning, the form, the style, and as much as possible the feelings of our target language in our community. That would be the Tagalog. And Charlie touched on the pakikisama, which is a virtue of the Filipino. It is inherent to us, and that plays a very significant role when we communicate to the Filipino community. They have to feel that they are being understood, that that we belong, and there's to be this friendliness. It is very valued. It's valued to the community. So I think, and some of our speakers said that translation is really difficult, but I think this research showed us that we have to capture those culture that is unique to the population that we are serving. And it kind of reminded me of a speaker that I attended recently, and she said that a community health system must reflect the community culture in order to serve them effectively. So I hope that our research here in Ketchikan will be open doors and also help serve our population better in terms of language and translation.
Well, thank you both. That was amazing. And we will be having follow-up because this is just the beginning. I do want to segue us into introducing our next panel participants. So we have both Shirley Williams and Sadie Olson of White Swan Environmental. So we very intentionally began our summit today with a land acknowledgement and grounding by Sadie Olson, and our panel would not be complete without inviting them to share the language revitalization efforts they have witnessed locally and presently in our communities. White Swan is a Native-led nonprofit and the co-founder of the Whatcom Intergenerational High School. Please join me in welcoming Shirley and Sadie Olson and for them to share more. So join the fun.
Uh-oh. There we go. Sama thanisnat choklamison, nuchisan makolia quinasanatachal nasglit quinasqual, aquinasqual, outsakachi, sakwalmi chasan, e utatasan quinas twinau. My traditional name is Kusama. My English name is Shirley Williams. And I am a 7th generation member and resident of the Lummi Nation, located in the uppermost corner of the Pacific Northwest in Washington State. I just want to share my gratitude to Peace Health and the coordinators for taking the time to honor language diversity today. My background is in nursing, and I almost gave up on it. I've been a nurse for 21 years. Half of those years, I worked off reservation and skilled nursing. I returned to my reservation to start a satellite medical office at the Lummi Youth Academy. And now I am driven for what I consider Indigenous public health and addressing root causes of trauma for Indigenous people and nature. And I wanted to share with you our website and a little bit of history that we have as Indigenous people and some of the efforts that we're putting through our Native-led nonprofit, White Swan Environmental. Sadie, her father, and I are co-founders of our Native-led nonprofit since 2015. We were fiscally sponsored by the Lummi Nation Service Organization, and then 3 IRS status August 6, 2018. And I will get going. So I'm going to put hopefully a question here in the chat because I'm curious kind of who's in the room. And the question is, are you Indigenous to the Pacific Northwest? If yes, please put your comment in the chat. Do you know the history of the first people of the land in which you live? If so, put the comment yes in the chat. And I'm going to share screen and show you our website, which I hope you will take a look at in the future. It's whiteswanenvironmental.org. And it helps us plant a seed for these efforts that help support thriving cultures and environment for all. We're kind of on the other side of the table for healthcare and the need for interpreters because our language is almost extinct. And as Sadie said, 2022, 2032 is the United Nations Decade of Indigenous Languages. And they believe by the end of this century, 95% of languages will be destroyed. As well as far as environmentally, it is said that that 5% of the Indigenous people help protect 85% of the land base around the world. And so we have come up with a solution to help protect our environment and our culture. We are told by our respected CM, Stokolf, that the waters and mainlands of this territory hold the sacred sounds of our people. Our first language was not Chinikawawa. That was a language that was used to help communicate with the French traders who came over early, and then the Hudson Bay. So I wanted to open up our logo here and let you know if you can see the 419 islands that comprise the archipelago of the Salish Sea. 1 year after the ratification of the Point Elliott Treaty, our saltwater salmon people who occupied these homelands were required to go to 4 different federally reserved lands. And I try to think about the what was going on in our ancestors' minds when they were knowing that we were being encroached. So the timeline, of course, of 1492 when Columbus discovered the Americas to 1620 Plymouth Rock to 1776, 13 American colonies declared independence from Britain. 1778, the first treaty with Native Americans was made. 1787, the U.S. Constitution signed Article 1, Section 8, Clause 3 of the U.S. Constitution with the President saying, quote, "The Congress shall have power to regulate commerce with foreign nations and among several states and with the Indian tribes," unquote. 1830 negotiations, so-called negotiations, treaty negotiations, begin to relocate the indigenous people, with the president quoting, quote, "What good man would prefer a country covered with forest and ranged by a few thousand savages," unquote. 1845, 5,000 settlers are located in Willamette Valley along the Columbia River in Oregon, what is known as Oregon State. 1846, the 49th parallel between the Treaty of Oregon is created. 1851, the first settlers arrive in Elki Beach in Seattle, Washington. 1852, Henry Roeder and Russell Peabody arrive at Whatcom Creek. So when we think about forceful relocation after 1830 and the pushing of our indigenous peoples north and west, and we had natural economic, social, political, cultural trades of commerce as indigenous people, and we had helped the French with their trading pathways from the East Coast to the West Coast. And then now we are getting encroached, once helping the Hudson Bay Company with the establishing settlers and sharing our wealth, and then sharing our wealth with Roeder and Peabody, who came to Whatcom Creek to immediately degrade the natural resources of that area, when our natural wealth as indigenous people was the fresh water and fresh food that was located throughout the archipelago of the Sailor Sea. During this time of treaty negotiation, supposed negotiation, and I have to question that because I still know elders today who have been shot at in the knee. My mother and my sister were shot at during the Bolt decision. So I imagine this relocation of our people was not very friendly, but was very forceful. When I think about my ancestry, which I would like to honor, I come from the 7th generation of Chief Seattle, located in the Duwamish Territory. He was the first signatory of the 1855 Point Elliott Treaty, and to this day, the federal government has not upheld their sacred responsibilities. My Swan clan comes from the House of Statithlam. I come from the 4th brother, the 6th brother, and the 7th brother. Recognize in Whatcom County the name of Seaholm. I come from the 7th generation of Mary Quillis Seaholm, where the new longhouse at Western Washington University is where my grandmother and her settler husband had occupied that territory. I'm related to Chawitsu. Chawitsu was a signatory for North Saanich, located under the Swan's Neck. North Saanich, 1852 Douglas Treaty, 2 fishes formally. He was also in welcoming the settlers in 1852 in Whatcom County. And then in 1855, he signs the Point Elliott Treaty to fish in our usual and accustomed fishing areas. To this day, none of that is happening. So as a nurse, when I'm looking at the climate crisis that we're in, and we are looking at the public health crisis that we're in, all I could say is that without Mother Earth, we do not have our health. Once we get encroached in this territory and we start looking like New York City, Vancouver, or Seattle, the environment being destroyed means that our ancestral languages and is destroyed. So that the work that we do through White Swan Environmental is survival work. It's literally survival. When my CM from Lummi and Saanich tell me the Creator gave us a sacred responsibility to the land, water, reef net, salmon, and language that belongs to it. And if it is not supported, it is cultural, spiritual genocide. And we think in the last 165 years, we're dislocated and disassociated from our land, territory, and way of life. Our inherent right to clean food and water is being violated. Our reef net technology, known as the most respectful, sustainable way of producing the most high quality salmon, is outlawed or forced out. And it took non-natives 10 years to learn how to operate that fishing technology. Now we stand beside archaeologists and anthropologists who get to teach about it and get paid for it. And we are, again, the anthropological curiosities. Our voice is often unheard. We don't even need an interpreter in a healthcare setting. Our wild salmon is at less than 5% of hanging on. And out of 60 nations at the Royal BC Museum, our language is at 4.1% of hanging on. So when I think about, according to Healthy People 2020, places where health arises through place-based factors such as stability, education, social and community context, public health, and built environments, I want to remind everyone that each one of those factors have been profoundly diminished within Indigenous communities since colonization and remain a challenge in present day. So from an Indigenous perspective, what I see as a nursing diagnosis within my community is I have encountered in the tribal nations that I belong to, including the following, quote, at risk for self-directed violence or spiritual distress related to socio-cultural deprivation as evidenced by lack of hope or purpose, depression, substance abuse, chronic illness, and suicide. At risk for environmental safety and health related to transboundary environmental exposure to contaminations, endocrine disrupting chemicals, air pollution, water pollution, organic food pollutants, petroleum metals, exposure to nature, as evidenced by dental and skeletal fluorosis, osteoarthritis, thyroiditis, cancer, and other chronic diseases, post-trauma syndrome related to historical colonial abuse resulting in loss of family, home, quality, environment, culture, and language, as evidenced by the high rate of health disparities to Indigenous peoples and nature in the Salish Sea. So to ask, when we're talking about how to have culture and language access, how do we build true capacity for Indigenous models of healthcare when we're built on a Western framework? Please take the time to look at our website, and Peace Health Rachel will be sharing our call to action letter. Thank you very much. Aishka.
Thank you, Shirley and Sadie. Very powerful words with a lot to really take in. I want to take this moment to ask all of our panelists to come on camera, because this is our Q&A section. So please join us. A couple of questions have already come in. I'm going to start with you, Nicole, first. One of the questions submitted was, what are some ways where you can see us being better partners, collaborators with our promotores? How do we help flourish that?
Okay, so can you hear me?
Now we can hear you.
Ayla?
Yeah, we can hear you.
Okay. Can you repeat the question, please? Sorry.
Sure. So the question is this: one of the things that we want to know is, we love the work that the promotores do, and we want to know how we can be better partners. How do we expand that collaboration? How do we spread that forth? Because as you know, with some of the work that we did for instance, with the vaccine efforts, that was a prime example of a strong collaboration with the promotores. So we want to know, how do we make that the norm, not the exception?
Okay, we are more than happy to collaborate with all of you. Just feel free to call Marcela or myself, and we can collaborate and develop different strategies to collaborate and help the community. We are more than happy to help.
Can you share a little bit of, if I am a member of the community, if I'm one of the nurses, the other parts of the team, how can I also get involved? That's one of the follow-ups, because sometimes it feels like the work is very top heavy. And I know that part of your mission is to really make this relatable to all. So what would that look like from your end?
Okay, first of all, we are going to make sure that the population that we serve is farm worker community. So if you are a farm worker, of course, we are going to be there for you. If you speak indigenous languages, we are going to have the right person to assist you. And we are going to know your needs. We are going to make sure that we are the right person who are able to help you. If we are not the best person to assist, we can be the bridge between you and other community services.
Beautiful. Thank you so much.
You're welcome.
I'm looking to Charlie and Joanna. How can we show respect and recognition of our multilingual employees? What do you think would be most meaningful?
You want to take that one, Joanna?
Go ahead.
Oh,
still
okay.
thinking.
So I guess the number one thing is pretty basic. I think it boils down to just being curious about somebody and being curious about their background and history, mainly because that will help people know that you actually are interested in them as a person. They don't just work here. They don't just seek their care here. They are people. So I think putting that into perspective can help how we operate day to day with our coworkers, colleagues, patients. So I think that is number one, and certainly celebrating various cultures and even having this discussion as well. Yeah, one of the other things I didn't really talk about in our study was that people really enjoyed knowing that someone was maybe into the same hobbies, from the same region, spoke the same dialects. So all of those commonalities really help bring our movement forward.
And I think for mine is, I think to show that show your interest and respect is authenticity first thing and foremost. You have to be authentic. And there are many ways to show authenticity. As introvert, I rely to books, and you could always start reading books if you're curious, learning about certain culture or race. That's usually how I start. If you're the introvert side of things, and just be sure, just authenticity, I think that will go a long ways.
Very well said. Thank you. We have a question here for Shirley and Sadie. Can you share more about the call to action for a longhouse and how that can revitalize language?
Me. Sorry, we almost missed that. Your question. Okay, so thank you. Well, we're bridging relationships, bridging the native, non-native divide, and supporting community healing. And our vision is a Coast Salish Tribal Heritage Field Institute, an Indigenous-led 13 Moon Mountain to Sea Reef to Reef K through PhD program with 7 longhouses in the San Juan Islands and 7 longhouses in the Gulf Islands. We are following our ancestral map, and we believe that when we can be present and we can practice, we can help restore the environment utilizing our sovereignty treaty protection and U.S. Supreme laws of the land. And when we are able to be present and in practice, we can protect the medicinals and the plants and do the restoration work and remember the stories of our ancestors and the way that our ancestors practice. We know that we always have to appease the dominant educational system that wanted to kill the Indian, save the man, but we are slowly making our way out of the bounds of the reservations in which we've been placed, and advocating to the city of Bellingham to have our village site put back at Whatcom Creek. This would be contemporary, where we would do intergenerational critical literacy and phenomenon-based learning as we balance Indigenous and Western ways of knowing and transform the educational system, providing knowledge democracy for all people that will support this new educational school. We have the potentiality to do that. It's written into the waterfront development. We ask you to send a letter of support. They want it to be a satellite national historical park. We ask you to outreach to, we've already introduced them to the San Juan Island National Park superintendent. Right now is the paradigm shift. We have an interim director who's the Office of Native Education, who's Lummi. We have a Native American Department of Interior secretary who oversees these places where we had our village sites, camps, reef net locations, and 13 Moon food sovereignty. And we have a Native American Parks director. And we have NCAI who wants to put us on emergency presentation for before June, so we can get a resolution to the White House. And just to say, we are Indigenous, we may live on the reservation, but we, under the Indian Rights Act, we have no less rights than a non-native under the US Constitution. So like Martin Luther King, we have the right to dream and speak and have conscious of thought. So thank you for asking. Hope that.
No, thank you so much.
I
Gabriela.
also add
Oh, no,
a
go
little
ahead. I'm sorry. Go ahead, Sadie. Go ahead.
I'm a student at Northwest Indian College. I forgot to say that earlier. And a lot of the work that we do through our tribal college, I feel like relates to what a longhouse restoration would help with and support for our peoples. So there's, like the language aspects, we'd be able to have a space where we'd be able to speak our language and a place to practice our traditional medicines and traditional ways of knowing and traditional ways of being. Like you said, it's important to know the interests of the people and what the strengths of the people are. And so having that strengths-based focus is really important. I'm a knitter. There's a lot of like fiber workers in our community. And so like there's a lot of community members who would be willing or able to gather in those spaces and to collaborate. And having community connection is a really important element of having health as human beings. And we don't experience that a lot. I was talking to my dad. He's a weaver. He learned how to weave, which is the regalia that I was wearing earlier, so that I wouldn't forget. He learned from our late hereditary chief, and that practice is a matriarchal practice. It's the women who pass down those traditions. But since it was almost lost within our community, he learned so that I wouldn't forget. And so now he's doing his spinning practices and dyeing practices and being able to teach me how to weave so that I'll be able to pass that on. And that's like history. That's us knowing who we are and where we come from. So that's really important to share forward and to gather our community members around. I just think that a lot of the actual practices that we're doing will support the language that we're pursuing, and that community members are gathering together to promote healing. We could talk about that all we want, but if we don't have a space to do that, then that won't happen. So it's really important to have a space and to acknowledge the true history of Indigenous peoples. There's a lot of history that's shared. I went to school and I wasn't able to talk about my relationship to salmon because I grew up in a farm town, and that was a difficult thing for me because all of the generations behind me have been fishermen. Every single person, and obviously it's a water abundant bioregion in the Salish Sea, as you saw on the map. So it was really important for us to acknowledge those systems and that they have been depleted to near extinction. And so we see those same declines of our relationship with nature and the decline of biodiversity in nature, because the reason that our ecosystem is thriving so well is because we were out there cultivating and having relationships with not only our people, but with the land and with the plants and taking care of those things. And so with a longhouse restoration, we'd be able to do those things again. So on the paper that has been shared, there's a QR code, so you can send a letter of support out on the first page, and then on the back page, you can view more of our website and see what you're getting yourself into. So thank you all for listening to us, and I hope you can send out those letters to our city of Bellingham representatives, as well as the federal government representative of, Deborah Holland, who oversees all of the national parks, and have that movement move across the nation so that it's not only happening in the Salish Sea and this national monument, but also to other national monuments. I went to Pittsburgh and I seen like some of the most polluted conditions that I've ever seen, and I didn't see any Native American representation. And so where we're not existing, our environment is not healthy, and we do exist. So acknowledging that is really important, and is acknowledging the history, the culture, the language, and our connection. Haishka.
Thank you.
That was beautiful, very well said. A definite call to action that we can respond to. So please get those QR codes and let's send our support. Let's have literally our fingers do the talking on that one. I want to take a moment. I'm really excited that Gabriela is still on with us, not just with me. It feels like it's with me, but with all of us. And so I do want to ask you something. Is there anything that you would like to ask these panelists, or anything that you want to say? Because you kicked us off and that really helped set that foundational piece for the rest of the discussions. And I would love to give you an opportunity to tie us all up.
Thank you. And honestly, I think I feel like I'm the lucky one, because it's very difficult when one is in academia to be grounded in community life. I can do that with my work in language documentation, and when I do language revitalization work with community members. But it's very clear, and we saw it today, that language, sustaining the linguistic diversity, which is the angle that I'm coming from with regards to all of the topics that we heard about today. Language revitalization, linguistic diversity, sustaining linguistic diversity is not just about language. And Sadie and her mom just said it beautifully right before me. So this has been a fabulous opportunity for me to see how some of our concerns in linguistics are manifested in other areas. You might not know, but I was at well, you did mention it actually, Kayla, in your introduction for me, that I was at the Smithsonian Institution before, and I sought out this area, the Pacific Northwest, for my next career step, because I wanted that closer connection with communities, both Native communities in the region, but also the farm workers and the Mesoamerican speakers of Mesoamerican languages, because then the language work would be not just about the language, not just about the grammar, not just about the teaching, but about language justice, about making sure that the language is there when an individual has a medical need, when the individual is navigating labor rights, when the individual is in the school system, etc. Sometimes, to be honest, I'm very humbled after hearing the work from Simar, and also when I hear the words that Sadie and her mom gave us, because I'm kind of just a nerdy linguist who likes to navigate all of those language family branches. And it's when all of us from different angles, from different aspects of life, come together that things can happen. This is the first time, I lecture a lot about linguistic rights in class and conferences, and this is the first time where I see all of us coming together, and I'm just like jumping up and down in excitement, and I got the chills 14 times during the 3 hours, because this is the future. Sadie and her mom said it beautifully. It's not just about the language. It's not about the longhouse. It's about the language and the longhouse and the salmon and the waterways and in academia, we silo everything. In life, things are not siloed, and we need to learn to bring all of these pieces together so that we can ensure our well-being and the well-being of others. So I'm very, very thankful for this opportunity. Thank you so much.
Thank you. The pleasure has been all ours. So I want to thank all of our panelists, because you truly inspire us and challenge us to follow your lead. This can be done, and it will take all of